Hello everybody, Dr. John here and welcome to Product of the Month. Now I'm really excited about this month's product because we're talking about a fantastic supplement called CanEVA. And CanEVA comes in a little bottle but very powerful in how it can change not only your pet's life but also your life as well. But like at the beginning of every product of the month, we need to go through a disclosure. And so I have been using CanEVA for over a decade. I've been recommending CanEVA to my clients for over a decade. It is in the store on Canine, Rehab on Demand and Veterinary Teaching Academy because I believe so much in that product. But apart from that, I have always purchased my own CanEVA for my pets and for myself. But in the store, there is an affiliate arrangement for any purchases that are made through our store. So without that out of the way, let's get in and talk more about what are the magical benefits of this incredible supplement, how it works, what it can do for you, your pet, and also yourself. And let's get into it. So let's talk about actually what CanEVA is, and it's actually ground elk antler. And we know that elk every year grow a new set of antlers. And so this process usually takes anywhere between 70 and 90 days for it to get to the end of what's called the soft stage. And that's where the antlers still have the velvet on the outside. They haven't lost the velvet and the antlers haven't become hard bone. So this is the antlers still soft, all that nutrients, growth factors, and we're going to talk about actually what's in CanEVA in a little bit, but all of those great biological products are still biologically active and available. And so they harvest the horn or the antler at the soft stage and they freeze dry it. And then they grind it up into a powder, and that's the powder that we have in the form of CanEVA. And so if I open up the bottle and I pull out, we see we have a little capsule, and the capsule is filled with this powder, and this is a small size capsule. It also comes in a powder for larger dogs where we sprinkle it on the food. This is actually the human version. This is my own personal CanEVA, and so you just take one of these capsules. But also for smaller dogs and for cats, they have a feline version. You just break the capsule and sprinkle it on their food, and it's really easy to dose. But as I said, it's ground up elk antler. So they freeze dry the antler, they grind it up through a process, and then they put it into the powdered form or the capsule form. Now, I also want to touch on a question that a lot of people ask about as we live in the age of ethical farming and ethical product production when it comes to a biological product that comes off an animal. And so CanEVA is produced in Canada in conjunction with elk ranchers. And so the animals, as we touched on, the antler grows every year and they shed their antler. And so the antlers are harvested humanely under supervision and ethical standards so they're not injuring the animal in the process. But of course, this is great for the animal, but also great for the antler because they're retaining all of the great nutrients and biological properties of the antler at the harvesting process to then be able to freeze dry it and grind it down to get the best nutrient supplements that they can to be put into the product. As an Australian veterinarian, I have also studied Chinese herbs and acupuncture, and antler is a big part of Chinese herb or Chinese medicine or Eastern medicine because of the cooling effects it has on the tonifying on the kidneys and the liver. And we also see these benefits in our patients when we're giving it as a Western supplement in its nature. So the effects of supplementing with CanEVA, it restores joint integrity, restores joint function, slows down cartilage degeneration, reduces inflammation, and maintains synovial fluid production. It also has been shown to reduce pain associated with degenerative joint disease, increased blood circulation, improve skin and coat condition, and strengthen the immune system, but also increase wound healing after surgery or injury. So we just went through the effects that CanEVA can have on your pet. So let's delve a little deeper into what those effects are. So we talk about joint integrity, we talk about joint function. And so we know the joint is based on cartilage. Hyaline cartilage is younger dogs. As that cartilage breaks down, we get a secondary cartilage formation or scar cartilage. And that's what degenerative joint disease is all about. So by supplying the building blocks, the materials we need to keep and protect that joint, we're actually supplying the materials so the cartilage can regenerate and rebuild itself in the early stages, but also lay down a better quality of scar tissue or secondary cartilage as degenerative joint disease progresses. And this is really important because as we age, we lose the ability to develop the building blocks. We deplete our bone we become osteoporotic because we're pulling calcium out, things like that. So by introducing the building blocks, the body can harness those raw materials to help rebuild the cartilage in the joint. We're slowing down the degenerative processes in the joint. So as we said, we're reducing inflammation because we're giving the building blocks. Actually, it has an anti-inflammatory effect as well. So pro-inflammatory mediators, part of the growth hormones and that come in this product, helps soothe down that joint and helps take out the redness and inflammation and all those toxic mediators that are associated with degenerative joint disease and death of the cartilage and erosion of the joint. We also mentioned it has a synovial fluid property. So it boosts the production of synovial fluid. So if we think of our joint, we have a joint cartilage that goes around it. And lining the joint cartilage on the inside, the joint soft tissue, is synovial cells. And they produce the synovial fluid. As we age, and we'll talk more about this in the hyaluronic acid section when we break down actually more detailed the components, but as we age, those cells lose the ability to produce synovial fluid. So this EVA goes in, actually plumps up, promotes those cells to produce more synovial fluid. That actually increases the interstitial pressure in the joints, pushes the joints a little bit apart, but also produce more of that viscous, lovely synovial fluid that actually bathes the cartilage. And as we talk about in the osteoarthritis program, we talk about how important that bathing of the cartilage is with synovial fluid for actually giving nutrients, feeding that cartilage and getting rid of waste material. So as we're losing that synovial fluid, we're losing that integrity of the joint, we're getting more buildup of the waste materials, and we're getting less ability to feed the nutrients to the cartilage material. So as we're getting this synovial bathing, this anti-inflammatory effect, this helps with pain. So we actually find that this has a pain relieving component to it. As we're getting rid of the inflammation, the redness, calming down that arthritic joint, we're then reducing the level of pain stimulus being transmitted to the brain. So we're getting a pain reduction. And this is all part of the increased blood supply that comes also to the joint, but also to soft tissue structures as well. This is not only, don't think about this product as a joint protection product, it's actually an all body soft tissue protecting as well, because we'll talk about its effects on muscle building, maintaining muscle mass, maintaining muscle strength, but also preventing muscle atrophy, because we also know that as we lose muscle mass, those joints open up, we get more laxity in the joints become painful. So if we're keeping that soft tissue supportive structure intact, we're keeping that strong, we're preventing the soft tissue atrophy, we can actually hold those joints tighter and we're preventing joint movement, joint laxity, and we're reducing pain. It also increases and improves skin and epithelial regeneration. So it helps with wound repair, with regenerating of soft tissue structure, and that comes back to then the strengthening, building muscle mass. And we'll talk about the actual mechanisms, how it does that in a little bit. But this is all part of the component of why this is such a fantastic supplement. So there are 4 main components to CanEVA. There's a mineral component, a trace element component, growth hormone component, and growth factor component. So we just talked about and listed the top 4 components that make up EVA. So the minerals, the trace elements, the growth hormones, and the growth factors. So let's dive a little deeper into what actually makes up these 4 core elements that are part of CanEVA. Now that we delve in a little deeper and we look at the components of CanEVA, it has a glycosaminoglycans or glucosamine chondroitin sulfate component, a hyaluronic acid component, an omega-3 and 6, a calcium component, an EGF growth factor, magnesium, IGF growth factors, collagen, and essential amino acids. So when we look at what's actually in CanEVA, one of the first things we see is glucosamine chondroitin. And this is really important because this is the building blocks of the joint. These are all the raw materials that go into helping promote healthy cartilage. And so this is a supplement I put my patients on if I know they have the propensity to develop elbow dysplasia, hip dysplasia. They're a large breed dog. We know that they have elbow dysplasia through radiographs. They're going to develop it. I put them on CanEVA earlier on to help give the building blocks to help support that joint, but also to build muscle and keep that muscle mass, because we talked a little bit about how it's so important to protect and support those joints with soft tissue structures. And if we can keep the soft tissue structure strong around that joint, we prevent that joint laxity and the beginning of degenerative joint disease. But also this is important in later on, or elite athlete dogs or performance dogs, dogs that are overusing those joints, punishing those joints through repetitive activity. I then put those clients or my patients onto CanEVA as well, because once again, we want to be supplementing those raw materials, but also we want to get on board the benefits of the muscle development, the muscle growth, and the preventing muscle atrophy from happening around that joint. We also have hyaluronic acid in the CanEVA product. And this is really important because also it goes hand in hand with the synovial fluid production, because HA is one of the major components of the synovial fluid. It's a really viscous, gooey, gelatin-like material that allows the bones to slip side by side. And as we age, we lose the viscosity of our hyaluronic acid. So as we start at 20, when we reach 50, we have half the amount of hyaluronic acid in our joints as when we were 20. And so we're losing, it becomes when you tap a osteoarthritic or degenerative joint disease and you pull out a little sample of the hyaluronic acid, excuse me, it's, as a young dog, it's really viscous and it pulls apart really and leaves this nice, almost like mucousy feeling. But as we age, it becomes more like water and loses that viscosity. So we're introducing hyaluronic acid back into the joint. But also as we age, the hyaluronic acid is like a 20-foot piece of rope. All the rope is the same, but as we go through our life and the joint rubs on each other, it breaks down. That rope is an analogy. So now we have 20-foot pieces, 10-foot pieces, 5-foot pieces. And the shorter the piece, the less viscous, the less chain of protective that this mechanism that this hyaluronic has. So we want to introduce back in more hyaluronic acid, get more of that 20-foot piece of young hyaluronic acid in to help protect the joint. We also have omega-3 and omega-6 fatty acid in the CanEVA product. And these are really important because they're anti-inflammatory, especially the omega-3 fatty acid, because that supplements itself into the arachidonic cascade chain to knock out arachidonic acid, or actually omega-6 in the cascade, because omega-6 gets turned into arachidonic acid that becomes an inflammatory mediator. If we can substitute the omega-3 for the omega-6 into that cascade cycle, we can prevent arachidonic acid formation and inflammation in the joint. Now, I can already hear people saying, but there's omega-3 and omega-6 in there. Yes, and these are natural, but we know with some disease processes, the omega-6 takes over. So we're supplementing and more omega-3, but there's always omega-6 available. Then we have calcium. We know how important calcium is for developing bones, preventing osteoporosis. As we age, we pull calcium out of our bones, especially as we then get degenerative joint disease. We see that as our patients not moving, they're not doing load-bearing exercise, they're wanting to lie down more than go for their daily walks or do those activities, those strenuous activities, they start leaching calcium out of their bones to protect the joints. And so this, by supplementing calcium in, we're helping protecting the bones from developing osteoporosis. We also saw that we had EGF, or epithelial growth factor. And so this is really important, really exciting, because there are some studies going on that shows that the EGF may stimulate mesenchymal stem cells, and they're responsible for regeneration. And so they're thinking that the EGF is stimulating stem cells in regenerating the joint, but also in soft tissue lesions and trauma. And this is also stimulating muscle development and growth, but also has an effect at helping with wound tissue healing. So speeding up soft tissue wounds after surgery or trauma by giving CanEVA. We also see that there was IGF, and that's insulin-like growth factor. And insulin-like growth factor is also responsible for, it's an anabolic or like steroid that helps build muscle, give the mediator signals to tell the muscles to start building size, putting on muscle, increasing tensile strength. So that's really important, especially when we talk about uses for CanEVA in a little bit, why I like prescribing CanEVA to my geriatrics, to animals who are about to undergo surgery, is because of the insulin-like growth factor. We also have collagen. It is rich in collagen, and collagen is the building blocks for soft tissue, for muscle. All the essential amino acids that come with that ripe developing antler is all part and parcel of what you get in the bottle, and this allows you to build muscle, give those mediators and building blocks to also build muscle, while you're having the glucosamine chondroitin component to help build cartilage and the joint. We're also getting the amino acids and the collagen to help promote muscle development. There are two studies we're going to talk about. One was done in osteoarthritis in dogs, and the other was done in humans. And in the first study, we saw the results were there was no significant improvement in the placebo group, but the group getting EVA had significant improvement in daily life activity, vitality, and gait. But this is the most important thing. There was no clinical changes in blood analysis. And this is really important when we look how we combine CanEVA with pharmaceuticals and other nutraceutical supplements. And we'll look a little bit more closely in the human study, where they actually looked at kidney and liver enzymes. So the dogs treated with EVA showed improved weight bearing, but it was also noticed increased muscle strength, decreased muscle atrophy, and decrease in joint inflammation. And we'll go into a lot more detail in what this means later on. So also dogs treated with EVA, investigators speculated that the palpation of the muscle mass relieved a significant reduction of atrophy, suggesting a myotropic effect rather than a simple anti-inflammatory effect. So the second study was a human study, and the results of this study showed that the group receiving EVA compared to the placebo group had a reduced body fat, reduced cholesterol levels, but here's the big one, had no liver or kidney side effects, and they were being given at a higher rate EVA than what is the dose rate in the CanEVA supplement for your pets. They showed increased strength performance. They also showed maximum heart rate went down, improved aerobic capacity, so this is really good for our elite athletes, and the placebo group also seemed to lose peak power more so when compared to the EVA group, and this is really great because this shows that there is actually an increase in tensile muscle strength for the group receiving an EVA supplement. So as I said, this human study actually was quite groundbreaking in because they gave higher levels of EVA than what is in the supplement CanEVA that we're giving to our patients. And they did this over a year and a half in human bodybuilders. And as I said, they then did blood panels to check the liver and kidney enzymes all through this process. And this is really important because we then know that we can give CanEVA safely with other supplements and other pharmaceuticals. And so in my treatment plans, I have 12-week pharmaceutical and nutraceutical regimes for different disease programs where we're combining supplements and pharmaceuticals, and CanEVA is one of those that can be combined with a non-steroidal anti-inflammatory because both the canine studies and the human studies show that it does not have an effect on kidney or liver enzyme levels. So uses for CanEVA. So as I said, I've been prescribing CanEVA for over a decade now, and I mainly use it in a number of different situations. So for young patients or patients that we know have been pre-diagnosed with joint dysplasia, elbow dysplasia, hip dysplasia, I then start them on a regime of CanEVA earlier on in their life than I would traditionally with a non-diagnosed dysplastic patient. And that's because we touched on a little bit earlier, we want to protect that joint. We want to give all the building materials that they can develop cartilage, protect that cartilage, but also build soft tissue muscle mass supporting structures around that joint to prevent the joint laxity, and it slows down the development of degenerative joint disease. It doesn't cure it because we know that they are predisposed to developing arthritis and degenerative joint disease in those dysplastic joints, but we can do everything in our power to slow down the development of degenerative joint disease. Then we have the elite athlete, or athletes that are competition, that we know that are going to be overusing those joints, overusing their soft tissue, doing repetitive activity or overuse activities. I like to prescribe CanEVA to them while they're competing through their adult life or competition life or work life for service animals, because once again we want to be providing those raw materials, but now we want to be protecting their soft tissue structures. We want to be protecting their ligaments, tendons, muscles. We want to be developing more muscle mass, more strength, because I love CanEVA for one of these IGF influences is it increases the tensile strength of existing muscle. And this is great for our competition and elite athletes, but also when it comes to our potential patients or pets that need surgery. If we look at an example of cranial cruciate ligament disease, we know that some breeds are predisposed to developing cranial cruciate ligament disease. And so we can help give CanEVA, if they have a partial tear or a full rupture, give them CanEVA before they have surgery to help build tensile strength in that soft tissue supportive structure. Actually prevents muscle atrophy, because that's the biggest hurdle we have to get over as rehab veterinarians. Is once they have the surgery, they're not using that limb for a couple of weeks or months, they lose muscle mass, they lose muscle atrophy, they lose strength, they lose conditioning. This is really hard to get on top of and rebuild, and that's why the recovery period is so long. Can take up to 12 months just to get my patient back to where they were before they ruptured the CCL. If we can bring CanEVA on early, because CCL disease, we know that it's a slowly progressive degenerative joint ligament disease, we can then be protecting that joint, preventing muscle atrophy, and also keeping that strength of that muscle. We can get them back quicker than we could if we allow that muscle atrophy to occur. But when we're using the example of cranio-cruciate ligament disease, we also know that there is a 60 to 70% chance they will rupture the other cranio-cruciate ligament in the other stifle within 6 months of the original rupture, because there is a genetic component to that disease. And so we need to be protecting the other joint at the same time, because when they have surgery on one side, they're weight shifting all their weight to the other side, overloading that joint, increasing the rate of degeneration, micro tears of that cranio-cruciate ligament, and perpetuating the rupture of that joint sooner. So this is all about protection and also all about muscle development and tensile strength to get your pet faster through the healing process and get them out the other side with minimizing the chance of any complications. So that's for my surgical patients and patients that are needing surgery. And then we have the geriatric patients. And CanEVA is fantastic. Once again, we've touched on all the way through helping giving the building blocks, anti-inflammatory, anti-pain in the joint, helping build the muscle around the joint, the tensile strength, making them feel more comfortable, because we traditionally know the joints that get arthritis have very little muscle coverage. The elbows, the stifle, the hip as we get older. So if we can protect that, cushion it with soft tissue, we make them more comfortable. We make them want to get out and move. And motion is lotion. Movement is life. And the more we can make them move, the more we take them on short walks into long walks, the more we're building that muscle, helping those joints release all that toxic waste product, the better they feel. And CanEVA is a fantastic supplement to help with that in getting our older geriatric patients up and moving and building mass and feeling more comfortable. And then we come to our last category, our neurological patients. And so when we're talking about invertebral disc disease, we're talking about degenerative myelopathy, we're talking about trauma, brachial plexus injuries, or any other type of disease trauma process involving nerves, CanEVA is a fantastic supplement, once again, to help prevent muscle loss, muscle atrophy, and keeping the tensile strength, because we know that we suffer if we use degenerative myelopathy as an example, we're losing the ability for the axons in the spinal cord to communicate to the nerve muscles in the hind limb to fire. So as those axons die in the spinal cord, we're losing the ability, they become paraplegic and eventually quadriplegic, but it's a slow process. So we want to prevent the muscle atrophy. We want to keep the muscle strength, because the more they can move, the longer they can walk, the longer they can stand still and support their body weight, the slower the disease progresses. And this is all about quality of life. And also, then if we use our invertebral disc disease patient as an example, we want to keep that muscle mass in the lumbar spine. We want to keep those hind limb muscles firing. Also, like a degenerative myelopathy, we want to keep them muscle intact, strength big, because the longer they can stand, or it helps them through their recovery process, either surgical, non-surgical, getting them back up, getting them on their feet again, getting them standing and weight shifting is so important with these guys to keep them and help them in their recovery process. Because if we can get them up earlier, if we can get them standing, their prognosis for a full recovery is so much greater than if they lose muscle mass. They're not able to support their body weight and they start to falling over. They can then hurt themselves. They can suffer other complications that limits their chance of a full recovery. So it's important we talk about side effects. I've seen very little, and the only side effects I've seen is sometimes diarrhea. And this usually occurs within the first week as they're getting used to the supplement, mainly with large breed dogs. Because we're putting a volume of powder on, I know my German Shepherd has a very sensitive stomach, and sometimes we can see diarrhea. I tell my clients, if you see diarrhea, just halve the dose. Spread it out over a couple of days just to slowly introduce your pet to the supplement is very important. But here's a big contraindication, that if your pet is diagnosed with any type of hormone-dependent tumor, because we know that the EVA has testosterone and estrogen components to it, and these are, I like to say, pouring fuel or gasoline on a hormone-dependent tumor because you're supplying it with the hormones it needs to grow. So really, the only contraindication is if there is a hormone-dependent tumor. But like with any type of supplement or nutraceutical or pharmaceutical that you're getting, please consult your veterinarian first to make sure that it is appropriate for your pet to start on this supplement. So I think by now you can tell I really like this supplement. I've used this supplement a lot, and I think it has very great benefits for our pets, but also for ourselves. Now, if you want to learn more or find out where you can get and order CanEVA, go to www.caninerehabondemand.com, and our store there has a direct link to the manufacturer of CanEVA and to their fulfillment house to be able to ship out the CanEVA products to you and your pet. So I want to thank you for your time, because I know your time is precious. And if you found information in this video, please click the like button down below, or please, even better, subscribe to this channel, because we're continually putting out information to answer your questions and give you the tools, the resources you need to help your beloved pet companion. And also, like today with CanEVA, help yourself learning about different products. And that's what the Product of the Month program is. So if you want to learn about other products, send your questions to support@veterinaryteachingacademy.com, and I look forward to seeing you on the next Product of the Month.